Welcome to this week's Knowledge Nibble, where we will discuss pain and exercise and have a think about how fear can play a part in animal rehab specifically. Apologies that my voice is a bit croaky. Typically for the first recorded Knowledge Nibble, I have a cold. So for those of you that know me and think, oh, that doesn't sound like Katie, it is me, I promise. I'm just a bit croaky. Okay, so first of all, as with all the Knowledge Nibbles, I want to try to provoke a bit of thought. It's not just about teaching you something new necessarily. It's about us all questioning ourselves and hopefully, opening our minds to becoming the best practitioners we can. So this week, like I say, we're going to be talking about pain and exercise. Now, pain is obviously a huge subject. And so we're sort of dialing in on something quite specific here that perhaps we might not have thought about so much previously, or not currently thinking about that much within our practice. So I just wanted to cover a different aspect and see if we can get a bit thinking about something a bit different. So first of all, I just want to look at the traditional approach and what we tend to think about with pain when we are using rehab for animals. So we have generally, we think about, pain equals tissue damage. So we think about a tissue damage where we'll have a noxious stimuli. So that might, be some injury, a wound. That can also be a repetitive injury. So basically something there that's causing this tissue damage. So we have a noxious stimuli, which causes the tissue damage and inflammation. And then nociceptors carry that information towards the central nervous system. And in the brain, that is perceived as pain, or that is interpreted as pain. So that's how we are normally sort of generally thinking about sort of the pain pathway and how it relates to rehab. Now, in response to that, our treatment would then tend to be as a sort of standard approach to rehab. Our treatment would tend to be to remove the noxious stimuli first. So, like I said, if that was an injury, let's say it was a wound, an actual traumatic injury, then just the fact that is healed and that is no longer an open wound, that's the noxious stimuli removed, and we should be moving on to healing. If it's something such as hoof balance in horses, it might be a case that we've rebalanced the horse's hoof. If it, say for dogs, maybe it's something like repetitive strain injury from jumping out of the car every day. Perhaps the first step would be to remove that and take away that element that's causing the injury in the first place. Obviously, there are times where we can't do this when it's related to internal factors like conformation, etc. But that's the first sort of step in the plan. Then we tend to sort of think about the next bit, so the promotion of healing into the next stage. So this will sometimes include rest. If it's not full rest, then it will be rest from exercise probably, or rest from extreme exercise. It might also include NSAIDs or corticosteroids, so something to reduce the inflammation, to help with pain control, so pharmaceuticals. And then we would be moving on to the rehab aspect. So within the rehab aspects, we'll be thinking about we're allowing the injury to heal, or we're promoting tissue healing, maybe by using electrophysical agents or manual techniques. But we're in now in a time frame where we want to promote that tissue healing. We're going to then think about increasing strength and function. And the way we normally think about pain and exercise specifically is that we want to address the dysfunctional biomechanics. And I'm very keen on this. This is something that I teach a lot. If we have the biomechanics are not optimal, and we have muscle imbalance, and we have problems with function, muscle firing, motor control, etc., then we are going to have more stress and strains put on the joints and the tendons and ligaments. So trying to address that dysfunctional biomechanics is a very sensible approach. So this is all great, this is all good, and it's all great, and it all works. But what when it doesn't work? So just now, if you'd like to just pause the presentation just for a moment and just have a little think, I'd just like to have a little think about what when this doesn't work, what when we have pain in the absence of tissue damage. So this is either comes on in the absence of tissue damage, so there's no initial injury that's been obvious or been a problem, been diagnosed, or it's after tissue damage, after healing, everything looks fine, everything should be great. Why do we still have a problem? So if you want to just pause just for a moment and reflect on that. Okay, so hopefully you've jotted down maybe a few ideas. And you've just had a little think about why there might be pain in the absence of tissue damage. So my reasoning for this, or my answer for this, I guess, is that it's important for us to understand that we can have a pathological pain state. So we can have a dysfunction of pain. Pain is doesn't always make sense. It's not always that, we damage the tissue and therefore it hurts. We heal the tissue and therefore it doesn't hurt anymore. Unfortunately, as much as I'd like that to be the case, it's not as simple as that. So we can get into a dysfunction of pain and a pathological pain state. And that's what we're going to talk about, and just have a little think about the aspect of a pathological pain state and sort of the emotional and the fear responses, which is what I want to go on to talk about. So central sensitization, persistent or chronic pain, persistent, chronic, you can use those intermittently. Persistent seems to be sort of the more modern term for what might have been called chronic pain. This is in the central nervous system. So this is a central nervous system issue. This is not a peripheral issue. This is not pain in a foot that's being persistent. It's not a tissue damage. It's not an inflammatory thing. It's a persistent pain within, or being recorded, if you like, within the central nervous system. And you can think of this like an overreaction. It's all a bit of a drama. It's very overreactive, and that everything's firing off and giving these pain responses when there's really nothing to be painful about. And so what I'm trying to do is a very short coverage of a very complex subject. So forgive me if I'm making it quite simple, but I just want to, get the key points across and try and keep it simple. So if you want to think about it like that, that's how I think about it. It's like an overreaction. And we have hyperalgesia, which is increased pain response to a normal painful stimuli. So what would be an example of that? Something like an injection, let's say an injection site. So an animal that's having a vaccination, let's say a horse, into their neck, and they really react, dramatically about a little pinprick, which really they should hardly feel. So it should be painful. It's a painful thing. You are puncturing the skin. It is a noxious stimuli, and it should be painful, but it's not that painful. So if you have a massive dramatic response over it, then that might be hyperalgesia, where there's just an over a dramatic response to what would be a normal painful stimuli, but that would be quite, tolerable. Of course, with animals, it's not this simple. A lot of this research comes over from the human literature, and with animals, as we know, it's not that simple, because it's very hard to interpret what they're thinking a lot of the time. And we really are, we can't say to an animal, did that really hurt you? Did that actually hurt? Or are you just frightened? Did it give you a shock? Were you surprised about it? Or whatever. So it's very hard, because we don't have that level of communication with them. And it's why we need to be very sensitive. Allodynia is a painful response to a stimulus that is not normally painful. So let's say thinking something like stroking an animal. Okay, so you should be able to stroke an animal without them reacting as if they're in pain. A very soft stroke shouldn't be a problem, but they can have a pain reaction to that. And that again is an overreaction from the central nervous system and the pain response. So heightened nociception, if you like. Okay, so what I'd like you to start to think a little bit differently about is the hammer here is representing repetitive strain and tissue damage. So let's try to get away from always just thinking about pain. Pain is tissue damage. Pain is inflammation. If there's no inflammation, then there's no pain. If there's no pain, then there's no inflammation. And obviously that's where we are thinking about, pain control, NSAIDs and steroids that work on the inflammatory mediators and the inflammatory processes. If there is no inflammation there and tissue damage and inflammation causing the pain, then they're not going to work. And so we can sometimes treat them with NSAIDs or corticosteroids or similar and not get a good response. And that's because the pain is not an inflammatory pain as such, and that they don't work on those pathways. So what I want to get away from is thinking always about tissue damage and inflammation and pain, and try and think about the animal as a whole system. So we always talk about biomechanics, and biomechanics is a very important part of it, but it's not really mechanics. So we don't change parts. We don't take pieces out and put them back together. I wish it was that simple. We could just tighten something up on one side and loosen something up on the other, and hey presto, we're fixed. But as a living being, we should be thinking more about the whole ecosystem. Okay, so the whole system, the neurological system, the musculoskeletal system, even the digestive system, the blood vascular system, the respiratory system, everything is intertwined. You cannot really just split them out like that. So try and think about the whole ecosystem of the animal, and specifically, obviously, during this topic, then the neurological system. Okay, so how does the CNS adapt in pain dysfunction? Okay, so these are, the unusual responses. This is not what you class as normal. So there are physiological responses, and I think it's important that we think about, there are structural changes. It's important to understand there are structural changes. And these are very complex. You can find out information about it. They're very, very complex of what actually happens sort of structurally within the central nervous system. But there's an immune response, just briefly to cover it for you here, just so that you understand there are some physiological responses. The immune response, there's an immune response which can increase inflammatory mediators, cytokines, etc. So there is that part where there is an immune response, and that's actually quite a big part. And it does actually have, without trying to confuse you, it does actually have some connection to like the amygdala and the fear. And there's another sort of train of thought down that way. But just to try and keep it simple for you here, we'll think about the increase in inflammatory mediators. And there can be a change in cell behavior. So our receptors, what might have been a proprioceptor might be changed into a nociceptor. And what might have been a nociceptor might change into a proprioceptor. So they do communicate in the dorsal root ganglion, and they can change their behavior, if you like. And so what this can lead to then is increased responsiveness of nociceptors. So nociceptors can become much more active and much more sensitive. And then also the other cells can act as nociceptors. Glial cells can take on that role. And so, we have this overreaction, then we have more of them, if you like. So you can get this really sort of amplified pain response. And people do talk about it ramping up. It can get worse and worse and worse. And in patients with chronic pain, persistent pain, then this can be, a major thing that's going on. But then also there's the psychological responses. And I think this is where we can really have an influence with exercise and our treatments, not just exercise, but our treatments. So it's important that we look at those and try and think a little bit outside of the box about how we might be able to use these to, not manipulate, I don't like to use the word manipulate, but influence these to make a change about the perception of pain. So that leads on to the perception of pain in animals. So first of all, it's important to just establish that pain is in the brain. There's a little bit of debate in the literature about this. So people want to be particularly pedantic, but pain is not, in a joint. Pain is not in a muscle. Pain is not in a tendon. Perhaps the cause of the pain might be there, but it's not pain until it's interpreted as such in the brain. And pain is a very personal experience. So if I were to ask one person, if I was to hammer a nail through two people's hands, which I'm not about to do, but if I did, and I asked one person, give me a score of 1 to 10 on your pain, and one person might say 4, they're obviously quite tough, and one person might say 8. It's a completely personal experience. It's totally subjective, and we're not really able to reliably interpret what one person might feel against another. We may be able to interpret what one person may say is an 8 and my pain's gone down to a 4, but trying to measure against other people, it's just impossible. And this is the same for animals. Some of them will have a heightened pain response or perceive a particular stimulus as very, very painful, and another one might not even notice. And I think we all find that with our therapists that we do, or any of you that are nurses, or when you handle these animals, you work with them, you notice that some are really dramatic and some are not so. And that it might not only be that, it could be that their anxiety and their fear plays a part, but it could be that they're, just got a different perception of what pain is and how painful things are. And then obviously we have the communication issues. Like I said before, you can't ask an animal, are you in pain or are you scared? Why did you react like that? Are you in pain or are you scared? I find myself as a therapist very often gently maybe repeating something and trying to distract them and see if that really hurt, or were they just not expecting it, or whatever. And how bad is the pain? We can't ask them that. Is it always there, or is it only when you move? What type of pain is it? We can't differentiate between different types of pain. Is it a throbbing pain? Is it an acute pain? Is it a stabbing pain? We can't communicate in that way with animals. We can look at their behaviors, and you should go off and should study pain behaviors, and you should know what these are, but we can't interpret what is behind that behavior, or behind that face, or behind that response, and how bad it is from one animal to another. We also cannot articulate to an animal that it's transient, which I think is, can be quite upsetting to think. If you have a really bad toothache, for example, you can say to yourself, right, I know I've got antibiotics now. I know that by tomorrow it's going to start to feel better. Or I know that by tomorrow night, after I've had painkillers, that I'm gonna feel better. But an animal doesn't have that judgment, so it really hurts right now, and for as far as they're concerned, that's it now. It's going to hurt like that forever. So they don't have that. We can't articulate that to animals, which I think is a bit sad, really. So we've got another moment of reflection, I think. Have we? No, we haven't. Not yet. Okay. Physiological factors then. So this is where I really want to dig down a little bit more. So emotional states can modulate the individual's pain experience. Okay, so that's a very important factor, I think, with animals. It's been shown in human studies. It's quite well known that things like anxiety, depression, and catastrophizing can increase your perception of pain. Your individual perception of pain. So if you're in a particularly anxious state, then everything might hurt more. If you're very depressed, then everything might hurt more, or sometimes even doesn't. You can't feel anything. Catastrophizing is something that's quite interesting, I think, with animals, because you tend to think, like I just said on the last slide, that animals don't have that sort of forward projection. They don't have the same sort of analytical brain that we do. And catastrophizing in humans really can lead to, a real ramp up of pain. And, for example, I've been diagnosed with osteoarthritis, and you just go home and you think, oh my God, it's going to get worse, and blah, 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 and you make yourself, really, really worried about it, and you get, it's more painful because of that. But I do think that animals worry. So, if we get ready to go away on holiday and we're packing our bags, or even getting them out the loft, our dog will know, 24 hours, 48 hours before we go away, that we're going away, and she will worry about it. She will sometimes not eat, or she gets upset, she completely changes her behavior. So I think pattern recognition. They can recognize patterns and therefore perhaps get really worried. In an example like that, maybe, an animal gets really worried every time somebody goes into the loft because they think that, so that's kind of a catastrophizing thing. So it's a bit, there are some of these elements like self-efficacy and stuff like that I think probably aren't related to animals, but I think catastrophizing is one that we should, keep an open mind on. But generally, we know that animals can be very fearful. We don't have that communication where we can say to them, it's okay, I know this hurts, but it's fine. Don't worry about it. It's going to be fine tomorrow. But we don't have that communication, and the fear can have a massive influence on how they're feeling pain. So I just want you to pause the slide again and just reflect for a moment. And the question I'd like you to ask yourself is, how much of what we see as persistent pain is actually caused by fear and survival? So in animals, when we consider we've got a persistent pain problem, is it actually a fear thing? So just have a little think about that before you move on to the next slide. Okay, so how can we use exercise in cases of persistent pain? So there is a physiological response. Again, it's much more complex than what I have it down here, and there's much more that's linked into it. But there is a phenomena which is exercise-induced analgesia, and this is caused by stimulation of the endogenous opioid system and reduces pain sensitivity. So it's like your natural endorphins, your natural opioid system. There has been shown in many studies that there is this analgesic effect of exercise. So that's one thing. It has been noted that, if you've got chronic pain, it can get worse at first. But if you can get through that to the other side and doing regular exercise, it can actually help reduce pain sensitivity. And that is a physiological, again, structural change. But thinking about the psychological aspect, so what we want to do, or what we want to think about, is the reconceptualization of the pain-related fear. Okay, so these animals, or lots of animals that we work with them, we think they're fixed, and then they've still got a movement asymmetry, which we'll very often put down to proprioception deficit, which is very true too, and this can all be affected as part of these same pathways. Again, we're an ecosystem here, and we're trying to split something out, but just to try and think about it individually, there can be fear of pain, a memory of pain, a fear of movement. In humans, there's a known phobia, kinesiophobia or kinesio something, that is actually a fear, a true proper phobia of movement. People just won't move because they're so frightened it's going to hurt. And, I think if we dampen that down a bit, we can probably think that some animals are like that. And they've got a memory of what the pain, every time my saddle went on, it hurt. So even though I've got a saddle that fits now, it's still going to hurt. They didn't know the difference. Every time I moved up a hill, it hurt. They're fearful of that pain, and they therefore don't change their movement because they're in fear. So just going back to this slide, let's just have a think about what we can do then, and just have a think about how we can sort of attack these three areas. So anxiety, I think, is a big one. So if the animal is in fear when they come to you, everything's going to be emphasized. And I think if we have an anxious patient, to some level, they're probably anxious unless they're really chilled out and laid back. But if they're a painful animal, then they're probably anxious to some degree. And the fear of you being there, the fear of something different, and the fear of you coming in and going directly to the point where they don't want you to touch them and everything can really heighten this experience. For those of you that work in a vet practice, animals coming into the vet practice is ample enough to get them into an anxious state. They remember being in there before and it hurts. So some of them can be really anxious about coming to the vets. So that's something we just really want to think about. And we want to try to, what we want to think about, and what we're not going to come to conclusion here in this short presentation, but how can we work on them so that we can reduce that anxiety and that pain that they feel when we're working with them, so that they're more confident to push through that, if you like, and come to the other side. Again, working with humans, the way they'll deal with this, is if there's a fear of movement, and a fear of going to end of range of movement, or an understanding, a human will think, well, if I do that, I'm going to damage my tissue again. They'll say, you can say to a human, this is going to hurt, but it's not going to damage your tissue anymore. It's going to make you better. So do these exercises and get to the other side of it. And you can talk them through that. We don't have that. So how can we get to the other side of this without inducing pain or too much pain, and without, discomfort? I think is okay, if we're doing it for a good reason, but we've got to calm them when they're in discomfort, because otherwise we raise their anxiety and that raises their pain level. So it's very important that we get really good connection with this animal and get them to trust us. This is why it takes 3 times, 4 times as long to achieve something with an animal as it does with a human, because we have to get them on side. Again, with depression, this is more, and catastrophizing, we'll put these two together. This is more lifestyle, enrichment, distraction. Animals, horses that are just kept in the box and are depressed, they're segregated from their friends, or animals that are, at home have got chronic pain, they don't walk out with their friends, they don't go out to play with their friends. They can go out and just sit out and watch everybody. Horses can be led out of the stable and be held so they can see their friends. It's enrichment. Trying to raise their spirits will help them with their pain, and will hopefully help them be able to move through this painful sort of period and try and dampen down this neurological overreaction. Okay, so that's it for this week. Hopefully you've just had a chance to pause those where I asked you to pause them and just have a think about those aspects within your practice, and have a little think about what you've seen in the past. Have a think about the patients that you've seen, and see if you can relate this to patients in your practice in reflection and also moving forward. So your action this week, so I've put here, is to debate the following questions with one of your peers. So connect with somebody on Facebook, speak to somebody that you trained with. We all have somebody else that we know that's a therapist. Prod them and poke them and discuss this with them, because that's where the learning happens, when we're in debate, when we're discussing. Just because we think we know something doesn't mean it's right, and we have to debate. That's the whole part of, what we are and why we move forward. So find a friend, and if you can answer these questions or debate these questions with a friend. In cases of central sensitization, how can we use exercise to calm the nervous system and address fear-related pain in our patients? How are we going to actually do that? We know it will help, but how can we do that? What is the difference between how we treat an animal who is in pain through tissue damage and a patient who has a heightened perception of pain in the absence of tissue damage? So we're looking at, it hurts because it's broken, or it hurts because I think it hurts. And I just think, just as my one last thing I'd like to say, it doesn't really matter. I mean, it matters as to how we address it, but it doesn't really matter if it hurts because there's tissue damage, or it hurts because I think it hurts. If it's still a 5 on the pain scale, to me, to an animal personally, in their experience, a 5, whether it's tissue damage or whether it's just pain perception, is still a 5, is still pain, and we still need to address it. So that's the end of the Knowledge Nibble for this week. If you're not subscribed to Knowledge Nibbles and you want to, then please go over to our website, which is animalrehabhealth.academy, and you can sign up for your weekly Knowledge Nibbles there.